Okay, this is another controversial one from the med students.
So I actually think this is potentially true. This is such a typical assumption, especially if you watch Grey's Anatomy. Hey everyone, my name is Rowana. I am a nursing student from Sydney, Australia. And today I am joined by Medico Syl, who is also a YouTuber in the health sphere in Australia, and he is a current medical student. So hello, welcome. So today I'm doing a video about some assumptions that we may have had about medical students, nursing students, and each of our professions, which could be an interesting one. Yeah, but before we start, definitely go and check out Syl's channel. I will link it down below, and also we've done a video over on that channel as well, looking at the different pathways into medicine and nursing, which might be of interest to you if you're looking at maybe thinking about either one as an option. So
This has been very juicy. I went to all my medical student friends and I basically just asked them all what's the kind of biggest assumptions we have about nurses. And some are a bit controversial, but just so you know, this isn't all coming from me.
Yeah. This is definitely not just from me either. I have pulled together some assumptions that some of my friends have had in the past, not now, but some things that I have also seen online from some people.
So let's challenge these assumptions.
The first assumption about medical students
We're all
is
nerds.
that, well, you're book smart, but you're not street smart.
Oh, so true. Well, look, things are changing. It used to be basically that you get into medicine based off grades, and it actually did take a long time, but eventually the whole medical sphere realized that that's a terrible idea. So all consultants got into medicine by being book smart, and a lot of them can be a bit sharp with patients and nurses and not team oriented. But now it's changing. I'm not book smart. I'm people smart. No, but now we get interviewed, and we get interviewed in kind of very personable ways. So my interview was basically just a chat, and they asked me what kind of books I like to read and what do I like to do in my free time, and it was very personable. So I'm hoping that more and more medical students are getting more street smart or people smart. Mm-hmm. Yeah. But to be fair, a lot of the kind of ward insight street skills that we get from nurses. Street smarts are. All right, I'm going to hit one back, huh? This was actually not from a medical student. This was from one of my friends. But his assumption is that nurses are the real backbone of the healthcare industry.
Such a nice assumption to make.
Is it right, though?
I don't think it is
right
to say... Well, I don't think it is right to say that any one profession is the backbone of the health industry. I think it's a very multidisciplinary team, and I think we typically think of healthcare as healthcare professionals as either doctors or nurses, but there are so many other health professionals out there. You can be a social worker, you can go into
speech pathology, occupational therapy, dietitians,
so many different things that you can go into that you're still working in the hospital and directly with patients. And so I don't think that nurses it's not right to say that we're the backbone, but I do think that without nurses everything would fall apart.
So that's a very nice answer. I think that nurses are the backbone of the healthcare industry. Doctors see patients for 5% of their days, but nurses are the ones that are by the patient's side all day. And but that was very nice.
You're welcome.
All right, hit me up. What do you got?
Right. Medical students and doctors can't make decisions for themselves.
Wait, personally or?
I guess you have a good understanding of treatment options for a patient, but don't know how to execute it in practice.
Gosh, I don't want to admit to that, but I have seen a lot of indecisiveness. And you want to know what it is? People who get really good grades are perfectionists, and that doesn't necessarily make a good doctor. You need to be decisive. Different fields are different, right? In the ED, it's not about being perfect. It's get the IVs in, take the bloods out, be brought, just bam, 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 bam. But if you're an immunologist and you are looking at the beautiful interactions between cells, proteins, and pathogens, then you need to, have the detail. And one treatment might take a year to decide on or whatever. So I think that's got a lot of truth to it. But it depends, because I feel like I'm very decisive, which is not always a good thing. I'm probably too decisive. I should gather more information before making decisions. All right, Ro.
Okay.
That's not an assumption, that's a question. Nurses will own a home before a medical student even graduates.
So I actually think this is potentially true.
Yeah.
I mean, I guess it depends on if you're just flaunting your money as it, like you're just like using it left, right, and center. But I mean, nursing, the degree is so much shorter than medicine. You get into your career a lot earlier, and you can start earning money a lot earlier. Which, I mean, if you're thinking about compound interest, if that's something that you want to think about, you can potentially earn a lot more money earlier on, and yeah, I guess potentially get a house earlier on as well, especially if it does take 6 years, as Medico Syl is saying. So
Yeah.
potentially true, but or not necessarily. So.
Depends how wise you are with your money. I've
Yes.
seen nurses buy very expensive shoes.
Oh yeah, that was probably me at one stage.
No more avocado on toast if you want your own house.
Yeah.
Your turn then, huh?
Okay. Medical students and doctors don't clean up after themselves in the hospital.
This is so not true. Okay, this was me yesterday. But yesterday was hard because it was a person who was, droplet precaution patient. So whatever you bring in, if you bring it out, you have to clean it.
Yeah.
And so sometimes I'll leave shit in there so that the next person that comes in can just reuse it, as opposed to taking it out, cleaning it, or having to throw it out and being wasteful. So for example, it might just be a tourniquet for a blood test. Like, I'll leave that in there so that it can just be reused.
I think also, I might comment on this as well. I've definitely seen it before when doctors have done a procedure and left everything for the nurses to clean up.
Oh, that's
But depending on the situation, sometimes it's necessary. I mean, if a doctor gets called away for like a resource or something like that and they don't have time, or if they are very busy.
Look, that's the one
but-
exception.
Yeah.
If there's a code blue and you have to go and... Okay, you can leave your shit out and maybe just come back later after the code blue.
Yeah.
But other than that, there's no
But just-
excuses.
yeah.
Where it's a team-based model, guys. There's
It
no one's better than each other, and we're all working together for the same goal.
Yeah.
So clean your shit, and I'm sorry if I've ever not cleaned my shit. All right, what do I got for you?
Yeah.
That all nurses and doctors are sleeping with each other.
This is such a typical assumption, especially if you watch Grey's Anatomy. No, that doesn't happen. People can complain about you to the board if that happens, especially if you're doing that in a hospital. It's definitely not right. So yeah, it doesn't happen. And if it was happening, you're like, everyone would think bad of you. So I don't know.
Look, your sexual relations are your business.
Yeah.
Just treat it professionally. Statistically, this is not the case, and yeah, it's not like Grey's Anatomy at all.
It's definitely not like Grey's Anatomy at all. Great show though, if you want to get into something and you have some spare time. All right, I have one for you.
Go.
Doctors have poor handwriting.
Oh yeah.
I feel like it's a given.
Look at that. Oh, you can't even read it. Who's got time to handwrite? Look, the Australian government has invested probably like almost $1 billion into electronic health records
Yeah.
because of communication errors in healthcare.
Yeah.
The main one being illegible handwriting from
Yeah.
patient charts.
So something that as a nurse and as a nursing student that we learn is if you're going to give a medication, and particularly if it's handwritten, one of the requirements for making it a legal order is that it has to be legible. So I've definitely been in practice where I have not been able to read a doctor's handwriting on a handwritten medication administration chart or something. So the whole movement in towards the EMR has been a massive plus for the healthcare industry, I think.
Which basically means that all the medication orders are typed in.
Yeah,
so it's all
so
good.
you can't go wrong, basically. Well, I mean,
But
you can go wrong, but
There's less errors.
chance. Yeah.
Yeah, no, I've seen doctors that almost do it on purpose. It's like, look at me, I'm a doctor, so instead of writing paracetamol, I'll just do a P, and they'll know what I mean. Okay, this is another controversial one from the med students. That nurses get too many breaks.
To counter that, I think doctors don't get enough breaks. So
That's probably the real issue here. Don't try and attack another profession, med students.
I think it can be quite dangerous if you don't take your breaks, and I think it's really important to just have like that 10-15 minute like morning tea or something, just to like de-stress and kind of recollect your thoughts and have a coffee. So
Yeah, breaks are really well protected in nursing.
Yes,
so
definitely.
nurses will come and check that you've taken your break.
Yeah.
I mean, this is legislation for a reason, and because people make mistakes when they're fatigued, and mistakes in healthcare are a terrible thing. So we don't want to make them. But they're not very well protected in the medical sphere. So more often than not, I'll see interns having their lunch while doing work. And me too, by the way. And I don't really know what to do about that. But
it's a difficult one, I think. If you are busy and sometimes you literally don't have time.
Really?
Yeah. So something that I've really liked that I've found on clinical placements with the nurses that are currently working have been that if you are supposed to be taking a break, it's scheduled at a certain time. Different groups of nurses go at different times so that you can split up the breaks and still have enough people on the floor to be able to monitor the patients that are there. So and people just people know when you're taking a break and they can keep an eye out for the patients that you're looking after for that shift. So
nurses are really good logisticians. They just know the logistics. Like, I'll do this so that at this time, and they can see into the future. It's pretty good. Mm-hmm. Okay. Oh, it is your turn. Oh, I just have so many. I just want to keep going. All right, your turn. Yeah, okay. I'll wait.
Okay, so the next assumption is that doctors don't take nurses seriously, particularly younger doctors.
Oh.
And maybe medical students as well. I don't know.
Is that? Oh no, medical students are like so scared of nurses because they know everything. I think don't take nurses seriously. Well, that's a problem if that is the case. Is it generally the case? No. I don't think so. And, I'm talking from my experience, not from a statistical kind of paper. But my experience is all interns, a lot of their advice to me when I ask them, like, what should I know before starting internship is like, befriend the nurses, they're the boss, they know what's going on. But, like, you have to remember people's lenses, okay? This is the beauty of multidisciplinary healthcare, people working from all these different social worker, occupational therapists, all these different lenses, is that they all have their specialty. And nurses have a really good insight into the behaviour and character and what the patient likes and dislikes and what they're likely to comply with because they've spent the day with the patient and you've seen them for 5 minutes. So you need to listen to that. But maybe in some situations, interns need to take the lead and sometimes disregard distractors. So, for example, the other day there was a code blue, and doctors are trained in a really systematic approach to medical emergency. And there was the nurse who was just saying, let's give morphine to help with the pain. And that is something you do. You do want to address pain in there, but it's not the first thing you do. And you have to respect that the doctor has to follow their pathway. Yeah, that could have been misunderstood as disrespect, but it's not. It's for what's best for the patient. And afterwards, the intern just talked to the nurse saying, look, I hope you didn't take that the wrong way. I just needed to follow my systematic approach to these kind of code blues.
Interesting.
Yeah, so anyway, you got to respect the nurses because...
and vice versa.
This is actually... my next assumption is that nurses hate interns.
I mean, from experience, I've only been a nursing student. I'm not a current nurse, and my job at the moment is an assistant in nursing. So I have very brief interactions with JMOs and interns and doctors in general. I think
JMOs are like junior doctors, like interns,
Yeah. Sometimes from experience, I've seen nurses get annoyed with interns because they don't know how things work in the hospital. But from that experience, it's like some of those interns have only been there a few months and they're still learning about the processes that are in place, and hospitals can be different as well. So yeah, I can see why nurses can get frustrated at junior doctors and interns for not understanding certain people's roles or the protocols in place, but sometimes it's not their fault.
It depends on the intern as well. Some interns, they ask a question and they're trying to learn how to do it themselves, and so that they don't have to ask again. But other interns might just depend on the nursing to do certain processes and just be like, oh, can you do this thing again? Can you you're the nurse, can you book the thing? And it's like, oh, look, that's your role and you know how to do it by now.
That's true.
So it's a character thing, and it's all about how we all work together and mesh. But I think, if we just have mutual respect and understand that we all bring value to the team, it's all for the patients, guys.
Yeah. I'm just should I say this one? Okay, doctors have a God complex.
Well, that's only because we're amazing. There's no other reason.
Yeah, I feel like some nurses definitely have a God complex too.
Look, it's so... you need to call these clowns out. It's so dumb because medicine is such a small factor in patients' health. right? You're in the hospital, you have a problem, sure, medicine helps you fix that problem. But in terms of your health, social determinants of health are 10 times more important than like medicine in terms of what your longevity and quality of life will be like.
If you want to help lots of people in public health and things.
Look, if you measure the impact that doctors have in terms of, it's called quality adjusted life years. So it's basically the number of years that are added to society from the work you do. So if someone has a heart attack but you stop that heart attack from happening and they live an extra 20 years, you've added 20 years to society. Doctors add shit all, like clinical doctors. So if you want to do things that actually help at scale, you need to teach. YouTube's a great thing because it scales. You need to do things at scale like research, education, policy, government, those kinds of things. That helps lots of people. But a lot of doctors with God complexes will help one person a day. Yeah. And it's like, stay humble, bro. Okay. All right, this is one you're going to have to cut. This is the assumption that nurses are failed doctors.
So I have thought about this quite a bit before in terms of nurses being failed doctors, or the assumption that people get into nursing because they couldn't get into medicine.
Yeah.
And I think there is an element of truth to that for some people, because medicine is a very hard degree to get into, and it can take years for people to get into medicine. And I think that's something that is quite unfortunate about nursing in terms of the fact that some people might think of nursing as a second option, because it for some people it is their top option, and that's definitely where they want to be. And it is I think because it is such a different area of healthcare, it's not just doing the roles that doctors don't want to do. So I think...
Look, nurses are the doers. They're the ones that are all day actually doing stuff with patients.
Yeah.
I mean, doctors, they have to do a lot of thinking and planning and they're up here. Yeah. And nurses are down here. Yeah. And no, so they're not failed doctors. They're just a different job with a different lens.
Yeah, we have and I think that's the difference, is that we have a very different lens. And I think we have a very holistic take on health and healthcare, and we're very patient-focused and patient-centered, which I think healthcare is moving towards anyway. Everyone is trying to be more patient and family-centered. The way that nurses work and research and educate is a very different way compared to doctors, I think. So
if you guys are wondering if you're a final year kind of high school student or whatever, and you're wondering about whether to do nursing or medicine, check out the video we did on my channel, Medico Syl, where we actually talk about the different degrees, how to get in, and what it's like.
Yeah.
That assumption is disproven.
Yes. Not true.
Not true.
Okay, this is an assumption that a lot of my friends have had, actually.
Oh.
Medical students don't have any free time. Difficult?
It is. That is difficult.
Mm-hmm.
I have definitely felt in my life that I had no free time. Look, medicine is definitely a lifestyle and not a job. You are always in the medical headspace, no matter what you're doing. No, I'm speaking for myself. Like, I'm always kind of like bringing my medical perspective to whatever I'm doing. Yeah, you can have free time. Look, one of the most amazing things about medicine now is it's moved to a pass-fail type system, so it's not as competitive once you're in medicine, and means people are more collaborative. You don't need to get full marks on everything, and you can just enjoy it a bit and do other things like YouTube, like what I'm doing here. But yes, you often study into the night, especially in the later years. You're with a medical team, and you'll spend your full days there and then have to study after. So there's a big burnout issue. But you know what? I would counter that by just saying it's self-directed. If you don't have free time, that's because the student isn't prioritizing free time. If you prioritize free time, you can make the time.
Yeah, it's the idea that however much time you give to a task, that task will take up that amount of time. So if you don't set aside time for free time, so many time things in here. But if you don't set aside that time to do the things that you enjoy, you will never get to do them, because you'll be putting all of the energy in your day towards the things that, towards studying.
So true. So, prioritize free time, make time for it, and you'll have time for it.
Yeah.
Here's another assumption, that nurses can't do anything without a doctor's order.
Okay, well, I mean, there are some times that we can't do certain things. So, like, we can't prescribe medications unless you're a nurse practitioner, which is you can become a nurse practitioner after you are a registered nurse. And sometimes you can prescribe medications in that setting. But typically, we don't prescribe medications. We can't just send a patient to CT without a doctor's order. And also, we're not diagnosing patients either. So, we can't progress with treatment without having some sort of direction from a doctor, really. But that being said, there are so many things that nurses can do. So, for example, we do a lot of patient assessments, and we don't have to have doctor's orders to do those patient assessments, especially if there is a patient that's deteriorating, because we're usually the ones that will see them first.
If a nurse waited for a doctor to do a patient assessment, a lot of people would be dead today.
Yeah.
Nurses pick up on a lot of deteriorating patients before doctors.
And there can be things like nurse-initiated medications, which are kind of basic things that you might pick up in a pharmacy, like Panadol and ibuprofen. Yeah, paracetamol. Like, there are things that nurses will do a lot of the time without a doctor's orders, especially when it comes to like a resus situation. So we can initiate like oxygen, for example, if the patient is desatting, obviously initiate CPR and start kind of that process.
I would say that 90% of the things that nurses do aren't from doctor's orders. Like 90% of your day is doing things that weren't from a doctor.
A lot of like clinical judgment as well. So and nurses can refuse to give medications to patients if we don't agree with that medication. Yeah. Or if the patient refuses and we...
I see this all the time. It's been like, you know...
As in, I'm a nursing student now, but as a registered nurse.
No. Nurses have to really be switched on, because doctors will prescribe like DVT prophylaxis, which is where you give patient medications to avoid them developing clots because they're lying still all day, okay? But if a patient starts, bleeding from the gastrointestinal tract, from their tummies and stuff, then giving them a clot-preventing medication increases their risk of bleeding. Mm-hmm. And if they're already bleeding and you give them that medication, that's a disaster waiting to happen. So a nurse can stop that medication from being given. So being an active part of the team is absolutely necessary as a nurse.
Yeah. We can also put in orders for things like multidisciplinary team consults.
Oh, cool.
So we can get a dietitian to come in and review the patient, or a speech pathologist. So we can do those sorts of things as well. And I think that's the important thing, is to consider the fact that we are a team. And so we do need to work with everyone at the same time to be able to achieve the best outcomes for those patients. And one of the team members is the patient themselves. So you have to be able to listen to them and make sure that they are fully on board with what the treatments that they're getting.
Yeah, so take that, medical students. Stupid assumptions.
Okay, I do have one more.
Bring it on.
Okay. Medical students and some doctors don't know how to care for basic needs for a patient.
For a patient's basic needs,
yeah. Activities of daily living.
It's pretty true. This is back to the book smart, street smart stuff. I've seen a patient saying, I really need a piss, and they have a pee bottle. And then the JMO just going to get the nurse, and it's like, I'll just give you your pee bottle. It's like, you could just do basic living things if it's easy. Yeah. So I think sometimes that's true. But most of the time, especially nowadays where we get so much exposure to the jobs and to other people's roles, junior doctors are actually pretty good, and we know how to help out with basic nursing jobs. We know where the cushions are. We can get if someone's uncomfortable, we can reposition a bit.
I think it's not readily taught in medicine, really, how to transfer a patient from a chair to a bed if they're not mobilizing very well. You might not know how to do that.
No, we'd leave that to the pros.
And to be honest, it's probably safer if they come and get a nurse in that situation.
Definitely safer. And sometimes we need to test if people, we need to analyze how people walk. And you'll see you'll see doctors try and pick the patient up, and you're just like, that does not look safe. Let's get a nurse who knows what they're doing. So we'd be a bit lost without our nurses, that's for sure.
So that's kind of it from us. I hope you enjoyed watching. If you liked this video and you want to see more from me or Medico Syl, I'll put Medico Syl's channel link down below so you can go and check his channel out, as well as the video that we've done together on his channel that should be up pretty soon as well, at the same time as this one.
Also, if you made it to now in the video, comment in the section so we know who stayed for the whole video, all right? Yes. We want to see who are the true fans.
Sounds good. All right, we'll see you guys in the next video. Bye.